We'll get started. Thank you for coming to this session. I hope you had a great meeting. I truly appreciate you all showing up. This is like everybody is with suitcases and getting out of the building. So again, thank you for coming to this session. This talk is about handheld ultrasounds. My name is Srikar Adhikari. I'm one of the faculty at emergency department in University of Arizona. This is my colleague, Dr. Adrian Arnish, who is one of the faculty in our department. She will go first. Again, feel free to interrupt anytime if you have any questions or comments, whatever you want to say. I do have some disclosures. She's going to show in the slide. Those disclosures have nothing to do. You will see there's not even one picture of the handheld ultrasound. Displaying some vendor or anything like that.
Hi, nice to meet you all. So we're going to talk about, today we're going to talk about strengths and weakness of handheld ultrasound. We're going to describe how to integrate handheld ultrasound devices into patient care safely and effectively. And we're going to learn the current research and then the gaps in the research that require further study. And then we're also going to discuss the future of handheld ultrasound machines in both the emergency setting as well as various other healthcare settings. So the ultrasound market, the handheld ultrasound market is forecast to continue to grow in the coming years. Emergency medicine is among the early adopters of handheld ultrasound. Is now starting to spread to other specialties, and we can only expect it to grow in the future. The global market for portable ultrasound equipment was estimated at $1.7 billion in 2020 and is projected to reach $2.5 billion in the year 2026, growing at a compound annual growth rate of up to 6.3%, depending on what site you look at. So let's discuss some of the strengths. It's undeniably cool. Ultrasound itself, seeing with sound and being able to make or narrow your differential diagnosis within minutes of the bedside is definitely a superpower that makes you a superhero. I think of the analogy of like a corded phone versus a cellular phone. I imagine this technology is going to revolutionize our work lives as the cell phone did for our personal lives. So, of course, there's many benefits. They're affordable. The price range is between $2,000 and $10,000. You can get a portable ultrasound for just under $2,000, whereas traditional ultrasounds are much more expensive. The accessibility, as far as they can be purchased by physicians of any specialty, physician assistants, nurse practitioners, nurses, or medics. And they're made with smartphone-like technology, so boot up times are shorter, and the complicated knobology that we probably have all had to learn is reduced to these familiar finger swipes and taps, which makes it more accessible. It's also ultra-portable, described as handheld or pocket-sized. It's made to fit inside a white coat pocket. And the ability to connect to an expert remotely has significant implications for education as well as remote use in austere settings, global settings, etc. So how many of you want to ultrasound a patient but have trouble finding your ultrasound machine? So imagine if you were able to have your handheld at your workstation and you can go with it in your pocket into the patient's room when you enter the room. So you can do your ultrasound while you're taking your history and doing your physical, and it expedites clinical care. So it can fit pretty seamlessly into your workflow, which, although ultrasound definitely makes everything quicker, with handheld ultrasound, it's even better for efficiency and productivity than the traditional cart-based systems. And many handheld ultrasounds have effective workflow solutions that can be incorporated into charting, billing, and obviously that's another great advantage, which we'll go into a little bit later. So let's talk about the evidence. This is my PubMed search for this presentation just for handheld ultrasound. So you can see that there's not a lot of research, but it starts going up significantly in 2018. So much of the handheld ultrasound device use in the emergency department is informed by small single-center studies with few randomized controlled trials, but the limited data we do have is promising. So there's quite a few studies, however, for the purpose of such a short talk like this. So I can't go into great detail about all of them. My objective is to just give you a little taste of what is out there so you can later explore it on your own. So this is an article that describes current handheld use in the emergency setting, highlighting a lot of the advantages, but also some of the areas of concern. It reviews some of the literature and discusses future potential for handheld ultrasound. Here's some cardiology literature that seeks to prove that handheld ultrasound can give basic diagnostic information such as LV systolic function and valvulopathy with improved accuracy compared to physical examination with both novice and experienced users, and it improves diagnostic accuracy. This is a publication from my home institution, Josie, and the purpose of this study was to evaluate handheld for peripheral IV access for nurses and paramedics. And it found that handheld ultrasound was useful and reliable for placing peripheral IVs with minimal complications. So based on this study, we've implemented a hugely successful training program where our paramedics and nurses can place IVs using a handheld ultrasound and not requiring your IV team waiting for your IV team from your hospital. This meta-analysis in heart shows us that experienced operators are able to accurately diagnose specific cardiac disease such as LV size and function using a handheld device. So of course, being accessible, radiation-free, and due to its small size and the ease of decontaminating the device, it's a reliable method to diagnose peripheral lung diseases as an alternative to repeat chest X-ray. This is from cardiovascular ultrasound that shows, this was a study of an integrated heart-lung IVC protocol. This included 2 frontal and 2 lateral thoracic scans, at least 1 cardiac view that showed the LV systolic function and IVC, which found that that protocol improves the accuracy compared to lung ultrasound alone, differentiating types of heart failure, and does so quickly. So it could essentially be done in not only emergency setting, but in settings such as pre-hospital. This is a semi-structured interview with 2 physicians that used handheld ultrasound in and around Wuhan during the COVID-19 outbreak initially. And they essentially found it to be great because they could carry it around, use it and disinfect it easily. It didn't take up any room or any of the power sockets. It was easy to disinfect, so it reduced the spread of COVID. And it allowed the physicians to detect early signs of COVID-19, follow disease progression, as well as identify associated conditions such as lower extremity DVT, et cetera. And I liked in here they said that the patients even found it sophisticated and stylish, which in the day of patient satisfaction is another consideration. This study evaluated lung ultrasound in out-of-hospital settings versus chest X-ray to detect and stage COVID-19 patients with pneumonia. And it showed that lung ultrasound can detect pleural-based disease more often than chest X-ray for stage 3 COVID patients. And the portability in the outpatient setting makes it preferable to chest X-ray. This was a retrospective study which evaluated COVID-19 patients who were hospitalized with respiratory failure, and it found basically that portable ultrasound is just as good as handheld ultrasound in the evaluation of COVID-19 patients with pneumonia. So transitioning to something other than lung and COVID, this was a prospective single-center study which focused only on diagnosis of proximal DVTs and essentially gave emergency physicians handheld devices and compared this with an expert vascular physician who did a traditional duplex venous ultrasound, and they, which was considered standard, and the comparison showed 100% sensitivity, specificity, positive predictive value, and negative predictive value. So this is a randomized controlled trial that compares the performance of experienced emergency physicians in IJ puncture using conventional versus pocket ultrasound in a training model, and found them to be comparable. Of course, needs to be confirmed in a clinical setting. So this, the articles in this review found handheld ultrasound devices had good overall agreement with higher-end ultrasound systems, as they called it, for specific clinical questions such as detection of ascites, hydronephrosis, screening for AAA, and when examining pleural cavities. So this is an ongoing study, a kind of up-and-coming work from our institution. My colleague here is doing a study that will likely show that handheld ultrasound can replace cart-based ultrasound in the setting of trauma for FAST. If any of you have tried to do FAST examination in trauma, you could imagine how a handheld ultrasound would be much easier to use than some of the traditional cart-based systems that take up a lot of space when there's a lot of people involved. This is a review in the Journal of Cardiovascular Ultrasound, which describes the data on handheld ultrasound in medical education is not complete, but following training, students can achieve high diagnostic accuracy in a specific number of applications, specifically cardiac. So future research opportunities exist here. However, we're starting to see widespread use of handheld ultrasound in medical education. A probe for every medical student and resident is a more common mantra, and we're seeing this growing. So this is an article that discusses the need for a standardized approach to teaching ultrasound skills and systematic assessment of the learner's capabilities as well as the impact on patient care. I like a quote from this article that says the key issue is the development of appropriate training and education of caregivers in the use of handheld ultrasound so that they will benefit patients through enhanced cost-effective delivery of care and not harm them through overdiagnosis or underdiagnosis, which are both risks. This is a small pilot study that basically concluded that a single medical student with a very brief training of 2 hours can have similar accuracy for diagnosis of specific things such as like pericardial effusion, LV function, compared to physical examination performed by senior cardiologists and cardiology fellows. So I would hypothesize that future research would verify these same type of findings. So think of the implication if we're using handheld ultrasound in medical education, that we can teach something that takes a career to diagnose in a matter of hours. There's not sufficient knowledge about how having personal access to just having a handheld device without getting teaching and feedback. So this study looked at internal medicine trainees. Those were given handheld ultrasounds, and those that didn't have handheld ultrasounds, they both got the same teaching, but it didn't show that having that ultrasound necessarily improved their abilities or competency. This is just a paper on needs assessment. One of the populations we need to consider is general practitioners, so people that are already out in the community that have some ultrasound training and how we're going to have a curriculum for this population. And then I'll leave you finally with just a case report of a 25-year-old female that presented with right lower quadrant pain while on a cruise, not with an unknown pregnancy status, no vaginal bleeding, stable, but the physician was able to determine that the patient was pregnant, and then with a handheld ultrasound, communicate with the emergency provider, who was then able to, based on those images, arrange for a helicopter transport. From the time that the patient presented to the helicopter arrival was 2 hours, and as soon as the helicopter got there, of course, she became unstable. Because the ultrasound did show findings consistent with a ruptured ectopic. She had been stable. When the helicopter got there, she became unstable. But if that hadn't existed, she would have waited till the following morning, and the protocol there did not have surgical services. So she was able to be successfully evacuated for emergent surgery. And I will now hand it over to Srikar.
All right, thank you, Adrian. So Adrian nicely outlined the benefits and the evidence behind using handheld ultrasound. That's all great. I'm here to give you the bad news. Not really bad news, but issues and problems using handheld ultrasounds. I think that's very important to discuss. Just show of hands, how many of you are using handheld ultrasound as of today? Lots of you. Fantastic. So I'm sure you found it extremely useful in whether it's for education or patient care and whatnot, but the issues are real and they need to be addressed like real soon. So let's go through some of these issues, and I really want you to comment, or if you have any solutions for any of these issues, I would love to hear. So like for every great thing, there are always going to be some downside, right? So this article actually is a nice piece where they kind of outline what are the different issues, what needs to be done, and so on. So it's a good read. I just put it out there. So image quality. So every vendor comes in, they show you these great images, right? And then they have these scanned images, and they'll find a model for you, and they'll scan. You'll go to this vendor shows, everything is fine and dandy. But for me, there's only one thing. Is your device as good as my card-based equipment in the emergency department to make medical decisions? If it's not, you can take your device back, because there is no reason. If it is not helpful for me to make a medical decision comfortably or confidently, so then it's of no use for me. I mean, I can tell you like education, all that stuff is great, but if it comes to patient care, is this device good enough to make medical decisions when it comes to medical legal or whatever that might be? Are you comfortable doing that? If it's not, that's a problem. So that's how I evaluate any product. So I would have to take the product, and I highly recommend this, scan several patients' need, especially if you're not buying for yourself, but you're buying for the pod, your system, whatever that might be. You have to scan for a good 1 month, like 5 people have to scan and say, you know what, this is good. We can make decisions, and we're comfortable with this. And this is the reason Josie is trying to do this study. Can we actually replace the card-based equipment in the trauma bay with the handheld devices? If we could do that, I mean, the study is just comparing with the card-based equipment, both normals and fast free fluid and other pathology. How does it do in the real time? And how long does it take? Is it easy to navigate compared to the card-based system? That's probably the answer is yes for that. But overall, are we good enough to make decisions for somebody who go to the operating room or in the trauma bay? So that's where it comes down to. So
have you found something that you feel is equivalent? Because in my experience, I have not.
So
like when I move like in rural areas, like no access to ultrasound is like a better than nothing.
Yep.
But at my academic center with a card-based machine, I'm never going to choose. So I'm not comfortable with that.
great point. I will say, obviously we don't want to name the vendors. Obviously one vendor does a really good job. Joe probably uses this one too, for cardiac applications. I think they have the same technology from their premier card-based systems, and they put it on the same, and they have crystals, so they actually do well just for the cardiac, I would say. So beyond that, I think it's we're not there yet. So that's the truth, and nobody likes to hear the truth when we go to the vendors and tell them, everybody wants to like a device like a toy. That's great, but are you going to be confidently making the decision? That's what it comes down to. So that's my take on image quality. But I'm optimistic that it is going to get better as years in the coming years. Then this is a real problem. So one device, the fan goes off. Like I was trying to scan my daughter, trying to compare 3-4 devices. My daughter is like, Dad, what is this noise here in my body? You know? So fan goes off really quick. So they really heat up a lot. And then, as you know, there are only few which they don't draw power from your tablet. Most of them have battery in the device. So they're going to get heat up. They heat up pretty fast. And some of them auto shut down. So they claim these things like they don't heat up for the half an hour, but we start using that Doppler in there, it even goes faster. So check it out before you buy the device. Scan your family, scan your friends, scan your whoever, and it's shutting down within 10 minutes. The fan is going off in 3 minutes. You have a real issue with the device. So that's what I have noticed. Wireless connectivity. So a lot of vendors are claiming, whether to use a Bluetooth technology, whatever the technology might be. The question is, can they simulate cell phones? Essentially, are these devices consistently connecting? That's what it comes down to. So again, you have to use them so often. You put this device and you're waiting, and then you have the light goes off, and you're watching this light. That's not good enough when you're trying to take care of patients, right? So again, wireless connectivity is an issue as of today. I still haven't found devices which would consistently perform all the time, connect wirelessly without issues. That is the truth. Compatibility, I think compatibility has gotten better, both platforms. Somebody was telling me yesterday that one device is still, when they connect for iOS platform, is still not doing well, even though the company claims it's doing great. So there are still compatibilities and connectivity issues. Battery, same problems. They can claim all they want, 7 hours, 8 hours, whatever that might be. That is not the truth. If you continue to scan, it shuts down, and then if you use Doppler, it's going to, even the Doppler is not ideal, right? So still, you start using Doppler, it's going to shut down quickly. It is not going to last that long. That's been at least my experience. As far as functionality, understand what you want. What fits your needs, right? No bells and whistles, right? The Doppler is like slow flow and fast flow. Really, you can't adjust the scale. Really, you have to find the real use for the Doppler yet. But we don't need maybe. So for fast exam or in the trauma bay, you don't need really. So you can get by without your bells and whistles. But you do need to know what fits your needs, whether that handheld ultrasound is ideal for that purpose, for that application. If it fits, that's great. This is a real issue, right? So are you going to use your device, or are you going to use what the hospital is going to provide? Are you going to let the hospital encrypt your device so that you can pretty much give your personal information to the hospital, or you're just going to take their tablets and use their device, right? So far, whatever we have done for our nurses, for peripheral IVs, on other purposes, we're just using the hospital-owned devices, like a tablet. Obviously, nobody wants to give their phone and have them encrypt, with the hospital-based systems. And that's something you definitely have to consider if you're going to implement something widespread. The entire system is going to use handheld ultrasounds. Consider these issues, especially if the device is HIPAA compliant. Cloud. Cloud is a real issue, especially in our healthcare. And I think Yale figured out some of these things. So cloud, first it's a subscription service, right? You talk to the vendors and they say they're not making any money on the device. They're making money on it's like Netflix, Hulu, whatever that is. So they're making money on the subscription services, and they want you to pay. So understand the cost involved in the subscription service. Second is, obviously you're sending the images. So our hospital says patients are their property, and they have not given any consent for us to send any images to any vendor for them to use for commercial purposes. So there's no way they would let us send any images to outside cloud, period. And certain institutions have figured out some contracts and whatnot, but understand that and make sure you talk to your IT, talk to your hospital administration before you start sending the images to the cloud. And that's a real issue if you did it. Disinfection. I know it's been, the pictures are somebody carrying in a pocket and things like that. Who is going to, after scanning that abscess, no matter how much I clean it, I never want that in my pocket, period. So I think that is not practical to carry anything in your pocket. As emergency physicians, we wear scrubs. I don't think we have that kind of big pockets to carry all these devices. So I think disinfection, it would be great to have something by where you sit that would actually charge and clean, just like you do the iPhones or whatever. But the way it's advertised, they can carry in a pocket, I think, especially after COVID, even though it's not described to, it's not known to transmit through fomites, but still there's 100 other things which can come through. So I really don't think it's practical to carry these in the pockets in the emergency department without having issues with disinfection. Great point. You brought the great point. Like the card-based equipment right there. Even with that, we're not wiping. Just imagine this. People just carrying, not wiping, and we'll be guaranteed to transmit some of the MRSA or whatever the other things are going wrong. Documentation is a real issue. I don't know what. We have these waves of residents. They do good for 6 months, and all of a sudden they get pissed off and they don't do, then we have to remind them, all kinds of stuff. That's for the card-based equipment. Think about handheld. Unless you have some app, which is, again, some sort of HIPAA protector on your phone or whatever that might be, that's going to be a real issue for us for documenting using the handheld devices. And then oversight. Vendors are selling the devices just like that for all the licensed providers, but this requires oversight. I have to, when I'm doing the lecture, I was like, did I ever talk to my group? Did I ever give me a lecture? You cannot just bring the handheld devices in. It's not Wild Wild West. So you can't be scanning people here and then do whatever you want. I've told a couple of people who bought the devices, hey, you can't just bring it and scan them. There are policies for this, and you need to be familiar with this, this, this. I've never given a formal talk. And that's really important to do that so that your group knows what they can use and what rules they have to follow. And you need to, they still have to follow the same credentialing rules if they're going to make decisions. And then who's buying the equipment, if they're buying or hospital is buying, and still it requires the same oversight, same QA. So I think these are real issues. Actually, that didn't occur to me that I really have to go out to the group and talk more about this handheld ultrasound so people are not randomly using it. Reimbursement, major issue, right? So who buys the device? And obviously, most of you are familiar with Stark's law. So did you buy the device? Can a hospital bill for the studies if you bought the device or if they have to buy the device? So this is something which need to be cleaned up ahead. If you're going to implement something like a system-wide handheld ultrasound system devices, so really something you need to have to discuss with your coding people. So who buys the devices? There won't be any sort of violations. And then saying this is a new stethoscope or extension of something is not going to work for a reimbursement, so we have to be careful. This is the reason I really had the idea of carrying in a pocket. Then it becomes next to the stethoscope, and then billing issues, right? It's still considered as a diagnostic piece, right? I know we can debate on this all day, but I think, in my opinion, I think still it should be a reimbursable service. No healthcare system is going to buy you 100 devices for 50 providers or whatever you have and just give it for free. They expect something in return for that investment. Great two-page policy. Everybody should be familiar with this one. Lots of good information written over there. We don't have answers for a lot of issues I'm bringing up here, including the ACF document, but there are recommendations and more evidence need to come out to address all these issues. Future looks bright. I have no doubt. I know there are a lot of issues as of today. I'm very optimistic. As years go by, these issues will be sorted out. And again, this is going to change a lot of how we do and what we do. This is going to put the handheld devices, not just the ultrasound enthusiasts. I hate to say this. If a small group of people continue to do ultrasound in the next 10 years, that's not going to make a big difference. It's just people who don't like ultrasound have to pick up the probe. And that's where I think the handheld ultrasound is going to make a difference. You have seen this. Again, not naming any vendor, 2 or 3 years ago before COVID, this particular booth in ASAP had so much buzz, and everybody's going there. And that's not just ultrasound enthusiasts, that's everybody. And that's the kind of buzz handheld ultrasound creates, and it can change it can bring non-ultrasound enthusiasts to come to the table as far as patient care. I'm not exaggerating this. This is the new reality. Patients, for some of you who are in AIUM, you probably have seen this. There is like a separate section, like a course for patient-performed ultrasound, like kidney stone patients, if they have pains. They come in, I don't know what the wait time is on emergency rooms right now. Average is, I don't want to tell where I work, but it's about 10 hours to 12 hours right now. So it's really horrible. So just imagine just coming in there for pain, not knowing exactly if that is really kidney stone. So this whole section, they talked about how patient-performed ultrasound could address some of these issues. And I think it will happen. Whether it's going to happen in 5 years, 10 years, I don't know. With the AI algorithms, I think it's bound to happen one of these days. Patients can actually perform their own ultrasounds using the artificial intelligence algorithms and whatnot. Okay? I think this is where I'm really, I feel like handheld ultrasounds are going to make a big difference. So academic settings, we know that we're actually trying to see if we can replace handheld ultrasounds in some pods where you would take out the card-based equipment. We would still need the card-based equipment, but it would replace maybe in trauma bay. Already we have done with nurses. So would be something like that. I expect to replace at least 50% of my equipment in the ED with the handheld ultrasounds, if provided the image quality actually is good in the next few years. But I think community practices, in non-academic settings where fellows are going, nobody's going to give them money to buy $70,000, $80,000 machines with not knowing exactly what the return on investment is. I think this is where it's going to make a difference, because one of my fellows is going to a big healthcare network in Phoenix. He has 6 hospitals. He has to implement a healthcare ultrasound program, and that works perfect because now he has devices, he has workflow solutions. So I think that's where I think it's going to make a big difference in the upcoming years, provided, again, some of these issues we discussed, they can address those. I do believe it is going to get bigger and bigger. It's going to be everywhere, whether in different specialties, different disciplines are going to use this. This is like a sort of like, maybe this is a bold prediction, but I do believe 50% of the compact ultrasound market is going to be replaced with the handheld ultrasound in 10 years. The reason I say that is, it was like some companies competing with each other in Bothell, Washington a few years ago. As soon as Silicon Valley jumped into the market, I think now that it's very competitive. Like, people are trying to compete with each other every day, trying to develop new technologies for handheld ultrasound devices. So I'm very optimistic that most of these issues will be addressed in the next few years, and the use of handheld ultrasound is only going to go up. And then I think what I'm really excited about this is people who never really cared about ultrasound actually like ultrasound, partly because of the handheld ultrasound. So that's the bright side of the handheld ultrasound. With that, I'm going to stop, and I would love to hear any comments or questions. Yeah, I think in the pre-hospital ultrasound, in the helicopters and so on, I think it's a great value to carry one of those. And I feel like I was thinking, I was flying the other day, I don't know if you guys looked at the box, what they have in each of those flights. There is an epinephrine, there is a little bit of oxygen. They really need a defibrillator, of course. I think it's not inconceivable to think that there will be a handheld ultrasound pretty soon in some of these flights, domestic flights or international, whatever.
So you said the image quality is not quite there yet. Do you think that's an issue with the hardware or the software? Like, if you buy a handheld ultrasound right now, I think it will be improved with over-the-air updates, or do you think that hardware is just not there yet?
It's a good question. So some of the devices have certain technologies. They're not using the traditional crystals. I wonder if they have reached the ceiling on those. And some of them are actually doing this hybrid technology between the crystals and the silicone. I wonder if they have more potential in the coming years. And then some of them are traditional crystals. They just need to get their software and the other, it's just resources, how much these big vendors want to put in the handheld market. The problem in the big vendors is, what do they want to sell? They want to sell their Cadillacs. They don't want to sell something like a handheld ultrasound, right? They want to sell their card-based systems. So that's a competing interest among them, right? So, but they know they're going to lose the market because of the fact that Silicon Valley is in. So all these small startup companies already have trying to sell the devices. So they're forced into making these handheld devices. And they're trying to do in such a way that these handheld ultrasound probes are going to be compatible with their card-based systems as well. So they have this whole line of products, the card-based system 1, 2, 3, and then this handheld probe, which is going to be compatible with your cell phone as well as their card-based equipment. So I think that's going to be something you will see more and more with all the big companies. All right, thank you so much for coming in the last session here, so I appreciate it so much.